All right.
So Scott asked me today to talk about the alpha omega-3 and why did I change this. I'm a scientist, but I'm also a clinician. I'm always wanting to make things better. When I did this initially, I did it based on what is balanced for the body, what it should be in nature. When we consume certain ratio, then we get healthy ratios inside your body. And as I start doing more blood tests and more blood tests in my patients, especially omega-3 index, I noticed that the patients didn't need as much omega-6, even though it should be higher than omega-3, okay? The people were having severe lower concentrations of omega-3. So I said, I gotta make changes again in the alpha omega-3. I gotta make it better. I gotta make it so it fix the problem, not just keep the balance. By the way, even though the old formula still got me good results, I wanted better results. So what I decided to do, change the ratio. I decided to increase the omega-3 content of this to much higher levels, but I also changed other things. I changed the omega-7, I changed the omega-6, I changed the omega-9 based on what we found out on blood tests, which is very cool. So people say, oh, I'm gonna take fish oil, it's the same. No, it's not the same. The problem with this is that when you're consuming fat, you don't consume one type of fat. You consume a combination of fat in food. There's omega-3, there's saturated, mono, and polyunsaturated fats. And when you eat, actually the most abundant fat in your body is monounsaturated fat. It's not poly, okay? It's not saturated fat. And actually the lowest concentration is polyunsaturated fats. The reason why is that is because the body doesn't want to oxidize. It's easier to oxidize or damage those fats. So the body is very smart. I want to keep a saturated, monounsaturated content higher than polyunsaturated fat. So if you look at the content of any food that has fat on it, any beef, any chicken, any fish, always the monounsaturated fats are higher than anything else, including the saturated fats. People don't understand that. Oh, I'm going to get a chicken compared to a beef. Well, still high monounsaturated fat because the body wants to protect, the body wants the flexibility of the monounsaturated fat, but they don't want too much flexibility of the polyunsaturated fat because it can be damaged. So this is the first fat supplement that has into consideration not only science but clinical changes in the body, including joint pains, including depression. It's all here, all in one. You cannot compare this to omega-3 fish oils because they're only omega-3 fish oils. If your levels are extremely, extremely low, yeah, go for it. But this has all the right combination. They are the polys, the monos, and the saturated fats, actually, believe it or not. And this is a combination of 7 different oils. Check it out. Thank you, guys.